Guys, this is the big day of getting my COVID vaccine.
Making history.
I didn't even feel anything.
Ouch, not even a wince. Dr. Nesheiwat receiving her vaccination against COVID-19 as a frontline health worker. But even as these coronavirus vaccines continue to be distributed across our country, a new variant of the virus has been popping up here. Florida, now the third state to report a confirmed case of that new, more contagious and transmissible virus strain, the one that was first detected in the United Kingdom. Colorado, California also have reported that infection of the new strain. So how and when can we get ahead of the virus and stop playing defense? Well, the patient is here. Dr. Janette Nesheiwat herself. She's a family and emergency medicine doctor, also a Fox News medical contributor. So Dr. Nesheiwat, Doc, glad you got the shot. We saw you didn't even wince, as I said. What was it like, and do you have any after effects? How do you feel?
Hey, Eric, Happy New Year. It was an amazing day because it signified hope. It gave us a sense of relief and joy that we are on our way to abolishing this pandemic. I didn't have any side effects after the shot. All I had was just a little bit of soreness in my arm. I got the shot a couple days ago. I'm going to need to get the second dose in 28 days, so we'll see how that one affects me. Some people have no side effects. Some people maybe a little bit of body aches, a little bit of headache, even a low-grade fever, but that is transient and usually lasts about a day. But it's something that we definitely need to get out for everyone, for all Americans, and as soon as possible. Of course, as you know, it's going to be done in phases. Phase 1, the nursing home residents, healthcare workers, frontline healthcare workers, and then the rest of Americans in a hopefully a very expedient fashion, especially as the number of cases are going up at an unrelenting pace, especially as we're seeing this new variant in California, Florida,
I know.
Colorado.
How concerned are you, and how concerned are you about this new one? They say the vaccines work against it, but you know, how do we know? I mean, how do vaccines work? You got to get a different flu shot every year because there's a different type of strain of the flu. Is that the same with COVID? Do they have to engineer something in the vaccine differently for each different strain?
At this time, the vaccine is shown to be effective against the current strain. It's undergoing studies and tests right now by Moderna, by Pfizer. You need some significant mutation in the virus for the vaccine to be ineffective. And if it gets to the point in the next year, 2 years, or 3 years where we need a new vaccine, it can be done. We can easily modify the mRNA vaccine that exists. That's the beauty of this new mRNA technology. So that's why it's important to have good genomic surveillance in the community to know what variants are out there so we can be 2 steps ahead and be prepared. But we also know that viruses naturally mutate. So this is something that's not new. It's expected. We just need to keep monitoring it. And in the meantime, when it's your turn to get your vaccine, go out and get it, and also wear your mask in the meantime as well, because we know that this is a very highly infectious, contagious virus, and we need a large amount of the population to be vaccinated or to have acquired natural immunity to reach national herd immunity.
You know, you just talked about go out and get it. Can you explain that process? Because you're a doctor, you're on the list, of course. They said that 20 million would be vaccinated by just a couple of days ago. That didn't happen. We're at about 3 million. You're watching now, you're home. Or you're in an assisted living community, you're in a retirement community, you're down at the villages, or wherever you are in your home. You don't have a healthcare worker, or you're not a healthcare worker, you're a normal, average person. How will we find out when we get the virus? Do you get a phone call? Do you call your doctor? Is it public health, the local public health system? How do I know when it's our turn?
That's a great question. The easiest thing for you to do is not only listen to your local news and follow the guidelines of the Department of Health, also talk to your doctor. Your doctor will guide you and let you know when it's your turn, what phase you're in. Are you in phase 1? Are you in phase 2? Are you an essential worker? Are you a delivery driver? Do you work in a restaurant? Do you work in a hospital? Are you a staff member in a nursing home? So the best thing to do is follow the CDC guidelines, speak to your doctor, and once it's available, you want to get signed up, go get that appointment. You want to do it without delay because of the variations in the virus that exist, because it might get to the point sometime, maybe in 2 years, maybe in 3 years, where we do need to tweak that vaccine. But fortunately, we not only have Moderna and Pfizer, we have several other vaccines that are coming out, Eric. As you know, AstraZeneca just received approval by their health departments in the UK. Also, we have We have Johnson & Johnson here in the United States, Sanofi, GlaxoSmithKline. So we're going to have several that are going to be out and available. It's just a matter of speaking to your doctor and following CDC guidelines, listening to the Department of Health information as it comes out.
And until then, and you were so crucial about the masks, washing hands, taking social distance, being careful. Everyone was together during the holidays, and they say you're going to see a horrible spike over the next few months. Final thoughts on that, Doc?
Yeah, unfortunately, you know, we're nearing 350,000 deaths, and it's predicted to have another 115,000 in the next month. But it's not too late. We know that we can control this by social distancing, avoiding crowds, avoiding confined spaces and congregations, and wearing your mask. And then when it's your turn to get that vaccine, understand it's FDA approved, shown to be 95% effective, safe, high quality, and can help save your life.
Yeah, 3,255 deaths day before yesterday. 3,255, more than 9/11, more than Pearl Harbor, more than the 1906 San Francisco earthquake. It's the Battle of Gettysburg every 2 days in our country, and it's up to us to also try to stop that. Dr. Janette Nesheiwat, thank you. Glad you got the shot.
Yes.
Glad you are dedicated to the medical community and all of our health. And we'll be right back.
Thank you, Eric.